Hi, this video is the art of hair transplant restoration surgery on a client with a class 4 or 5 hair loss pattern, and he actually losing from the front all the way toward the back. So he has some residual hair on top, but it's thinning. It's on his way out. So our goal is to harvest at least 4,500 grafts using the strip method and filling from the front all the way toward the back. You can do the FUE too, but the FUE will take multiple sessions. Around FUE I can do around 2,500 to 3,000 grafts a day. Strip method we can go 4,000 all the way to 6,000 if we need to, all in one day. So hair transplant recreation the hairline is very difficult. It's not just requiring the surgical skill of the surgeon, but it requires a lot of the artistic and aesthetic detail to ensure very natural result. And this client not only lose front to the back, but his temple on the side has gone back. So we have to not only lower the hairline, but bring in the temple as well. If we don't bring in the temple, then you just have a low hairline with a wide forehead. You know, you have some hair but a little bit off, and you want to be as perfect as you can. The temple is really important. It will frame the face. The goal of temple is not for density. The goal of the temple is more of framing the face and bringing the feature closer, so it allow you not to have a V pattern but actually more parallel. So from the eyebrow to the hairline for Asian and blacks around 6.5 centimeter to 7. For Caucasians it's around 7.5 to 8.5 centimeter. And the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline. As you can see, let me turn this way for me. See, his temple has gone straight down. So my goal is to curl back in. And there's a couple ways we can go. There's a crevice around the ear we all have, and we'll go straight up and come back up right here. And that's where we kind of figured out where the temple is. And then where the eyebrows end, you put a finger breadth, you go straight up, and that's where it should begin, right behind it. So we can connect that. And again, for Caucasian, most acute backward, Asians less, and black is like perpendicular. For women, it's pointed forward. And again, once we get the shape of the temple and it was transplant very precise angle, the front is around 35-45 in the front, and it will flare out. In the back, on the side, the temple is flat against the skin and pointed down backward. It's not coming out that way. So really, the temple angle here very important, very flat and backward. If you look straight across from me, okay. Once we get the shape down, no hairline straight, so zigzag through it. And then the precise angle, as I mentioned already, and the selection of hair graft. We try to plant rows and rows of hair graft in the front, followed by the 2 hair, 3 hair, and 4 hair in the back for bulk and volume. And if you can look down for me a little bit, you can see how thin he is from front all the way toward the back. And we're going to fill from the front all the way toward the back using 4,500 graft.